Shut-ins and residents of homes for the aged are being vaccinated under the Northwest Regional Health Authority's Elderly Express experience. The program is meant to offer a quick and easy way for those 65 years and over to get the jabs. Kimberly De Souza visited the Living Water Community's Mercy Home, the first to benefit from the initiative.
One day after commemorating World Elder Abuse Day, which highlighted some of the injustices meted out to one of the most vulnerable groups in society, people 65 years and over got their jabs using a shorter and quicker process.
This is our first attempt to reach out to Home for the Ages to start to see if we could come out and vaccinate them on site. These are people who cannot leave their place of abode to come to the hospital.
Members of the Living Water community also received their first dose of the Sinopharm vaccines. Director of Health, Dr. Anthony Parkinson, said the experience will also be extended to 7 health facilities under the NWRHA, adding that the program is meant to reduce the crowds and walk-ins from assembling at the health centers.
It's just that when you come in now, we're not under that pressure. Right, you come in, you sit down, relax, you get your vaccine, and you leave. People coming in very anxious, because you're coming for a vaccine, but when they see the needle, people get a little anxious. Some people kind of want to faint. But now you come in a little bit more relaxed. And we could talk to you, we could talk you down, we could calm you, and you get your vaccine and you get out.
Administrator at Mercy Home, JOANNE SANKERALLI, said there wasn't much vaccine hesitancy at the home. With only 6 residents, 4 people came forward to be vaccinated. She appreciated the ministry's thrust to get those at the home vaccinated.
We see this as a positive step in the direction and a benefit to not only our organization but to so many other elderly and shut-ins that may not be able to avail themselves of the vaccination.
One member of the Living Water community who was not a resident of Mercy Home said the vaccination process was easy.
It was good. Everything went smooth.
Yeah.
We came in and got the forms filled. Everything was organized well. And just had to wait until I got the jab.
Dr. Parkinson urged more people to come forward to take the jab. Kimberly De Souza, TTT News.
The elderly are valued members of the country and will be treated as such. This from CEO of the NWRHA, Salisha Bash, as she described the new vaccine rollout system called the Elderly Express experience.
And basically, we are aiming for express service, great service, meaning lesser wait times. So we do provide refreshment for them. We have care ambassadors at our health centers who would be more or less assisting these elderly with whatever part of the stage of the vaccination process they are at. If it is filling out the form or even ushering them into the different areas as the vaccination progresses, between the screening to the vaccination, to the observation. So there's more or less like a one-on-one service that we want to provide our age population. So by the time they leave, their experience would have been a pleasing one and one that was not distressing upon them and make them as comfortable as possible throughout the entire experience.
The 7 health centers across the NWRHA now use NCD clinic listings to schedule individuals over 65 for their first vaccine dose. They also take the names and contact information of walk-in persons who have not been a part of the clinic. All this while accommodating 10 persons per hour has been going well, except for one glaring problem out of their control.
We are noticing that persons are coming like 2 hours, 3 hours earlier. So some people would have had an 11 a.m. booking, but they would have been at the health center since 8 a.m. And of course, because we have spatial constraints that can cause some clutter in the health center. So we want to urge persons to come for the times that they are actually given instead of showing up 2 and 3 hours earlier for their given time. We know it's a cultural thing, but we really want to urge the members of the public when we do schedule you for a particular time to come at that time instead of earlier, because we really want to minimize on the crowds that are there at the health center, and that's why we are doing block appointments, because we know how many persons we can accommodate per hour at the health center.
Ms. Bax said that persons who would have initially had appointments for the weekend have already been rescheduled to different dates.